Welcome back to Transcriber from Reddit. Today's topic, a website read, comes from the website fortune.com. This is an article that was originally posted on May 20th, 2024, written by Karen Twaronite. As we can see here, the original article, you can read so much of it before it asks for you to subscribe to keep reading Fortune. However, I went to archive.is where I can read the whole article for free. Both versions will be linked in the description below. I will read the website article, then give a reaction to it. The title of the article reads, "We know very little about neurodivergent women, and they may be entirely overlooked at work," falling under the tags commentary and mental health. Below the title is a picture of a woman who's staring wistfully towards a window. We can see in the window's reflection part of the building that's outside the window, but we see more of her reflection looking back at herself, which creates a visual juxtaposition of her self in real life and the vision of herself in glass. Below the image reads the description, "Men are more likely to be diagnosed as neurodivergent than women." Source: Getty Images. I begin reading the article. Approximately 15% to 20%, linked here, of the world's population is neurodivergent, meaning a diagnosis in women is anything but rare. However, it's all too common for women to mask their neurodiversity or to have it go underdiagnosed entirely. And those who do identify as neurodivergent may experience unique barriers as they look to advance their careers. I recently had a conversation with one of our partners, a neurodivergent woman who shared the challenges she faced to obtain an official diagnosis. It was through her mother's relentless determination that she was able to recognize her strengths and the skills that she could maximize. Without that, she may have been potentially overlooked, and we would have missed out on a wonderful partner in our firm. Section: Why women that identify as neurodivergent are being overlooked. According to the Australian Psychological Society, linked here, stereotypes are partly to blame for gender-specific diagnostic gaps. There's a general lack of understanding of how neurodivergent traits present in women, parentheses, often more subtly, which makes them easy to miss, and parentheses. Boys are diagnosed with ADHD at a 3-to-1 ratio compared to girls, linked here. Boys are also 4 times likelier to be diagnosed with autism and twice as likely to be diagnosed with dyslexia, both linked here. This female underrepresentation in the workplace isn't just an issue related to neurodiversity. Lean In's 2023 Women in the Workplace study shows that, linked here, despite gains in senior leadership, women remain underrepresented at all levels, especially women of color. The research also points to women at the director level leaving at a higher rate than in past years, and noticeably more often than their male counterparts. Anecdotal evidence shows that when women, particularly neurodivergent women, do not get the support they need at work, the number of women in leadership roles is directly affected. This research is important since we know the influence of women's representation in leadership roles remains tangible and significant for the top line, bottom line, and organizational culture. An EY, DE&I internal study in 2023, linked here, found that teams with a higher percentage of female partners have both higher revenues and margins. As EY Global Vice Chair of Diversity, Equity, and Inclusiveness, I've been part of the EY organization's ongoing journey toward greater neuro-inclusion, and I'm personally keen to understand how to help women who identify as neurodivergent thrive in the workplace. Part of my work includes conversations with professionals of various ranks and identities to help us cultivate a better sense of belonging for all and an environment that supports a broad spectrum of flexibility requirements and working styles. Through these conversations, 3 common ideas have emerged. First one, the importance of new inclusive policies or tangible updates to existing ones. Reviewing, enhancing, and updating policies and processes can open the door to new perspectives. For example, a traditional hiring process can challenge many neurodivergent professionals, particularly interviews focused on social competence versus job-related or technical skills. Creating recruiting, performance management, and promotion policies that prioritize performance-based metrics, along with more frequent feedback discussions around performance expectations, can help neurodivergent women be more successful as they navigate their careers. 2. Staunch leadership support. Since neurodivergent women tend to present differently than men, taking time to ask questions about how to support them is a useful way to start. Then, creating accountability around those ideas. The EY organization decided to standardize having leaders evaluated on inclusive leadership on a global scale to ensure there was a consistent bar set and an effective way to measure. A key part of this is also training managers to assess and weigh technical skills versus non-technical skills to evaluate performance against the requirements of a role. Another idea that can go a long way towards inclusion is a sponsorship program. For women who identify as neurodivergent, having a sponsor who truly advocates on their behalf when they're not in the room is a game changer. For those struggling to make connections, sponsors can play a pivotal role in ensuring they are heard as they advance their careers. Number 3, establish psychological safety. It may seem simple, but awareness building goes a long way to create an environment of psychological safety. E-learning courses, producing toolkits, and organizing company-wide events can help individuals, supervisors, and teams build a more neuro-inclusive environment. As most women's expression of their neurodivergence is not apparent, greater psychological safety can be established by communicating the advantages that cognitively diverse teams possess consistently and with actionable tactics. This type of education can reframe the perception of disabilities as a strength and offer specific actions or ideas to create more inclusive environments. Number 4, neurodivergent professionals often possess in-demand skills and drive powerful results. It's important to recognize that neurodivergent individuals often see the world differently, leading them to try approaches or see solutions to problems that others may not. These specialized skill sets can include an aptitude for complex problem solving through data and emerging technologies, creativity, and innovation. In today's talent environment, these are often the skills in highest demand. As organizations invest in tech capabilities, having talent whose skill sets align with the needs of these roles helps the business too. At EY, through the organization's 23 Neurodiverse Centers of Excellence, NCOE, globally, we've seen neurodivergent professionals develop creative solutions resulting in new innovative products, increased retention rates, and millions of service provision hours saved, enabling almost US $1 billion in value creation. More importantly, it has also been acknowledged by the neurodiversity community, particularly women, that having dedicated hiring and career progression strategies has been a driving factor in increasing the discussion around self-disclosure and building a culture of greater acceptance and understanding. Last section. Gender representation shouldn't exclude neurodivergent individuals. As organizations continue working to balance the gender representation in the workplace, thinking about less understood identities like neurodivergence can help progress, inclusion, and cultivate a sense of belonging for all, without judgment or exclusion. Through the lens of cognitive diversity, there's a real opportunity to tap into the unique differences that allow individuals to think, learn, communicate, and socialize differently. Only when women who identify as neurodivergent feel free to be their authentic selves will they bring their full potential to the workplace. Our businesses thrive on the strength of our people. Including neurodivergent women in conversations about gender representation not only enhances inclusivity, but also adds significant impact. Below the article reads, Karen Twaronite is EY's Global Vice Chair for Diversity, Equity, and Inclusiveness. The views reflected in this article are the views of the author and do not necessarily reflect the views of the global EY organization or its member firms. My thoughts on this article are, if you want more neurodivergent individuals to be represented, why hide this behind a paywall? If neurodivergent individuals struggle, especially if there's research showing that they're noted to struggle more, then they probably don't have the money to pay $99 a year for access to just this article. Otherwise, I like the points that this article has. The biggest struggle, though, is that the mindset of many people nowadays is still that it's primarily men who are affected by neurodivergence, not women. A couple ways to combat, in my less than humble opinion, are have universal health care in the U.S. You don't want universal health care? Then let's make universal psychological care available for everyone in the U.S. by making, at the very least, the skills of psychologists, of counselors, of medical professionals who specialize in diagnosing these behaviors, not just neurodivergence, but also mental health, to make that a funded public program so that everybody has access to this, so they don't have to pay out of pocket, so they don't have to decide whether or not the money goes to their monthly apartment allowance, because if they can't pay for their apartment, they'll get kicked out on the street, or if that money should go to paying a medical professional to get some help. People shouldn't be forced to make those decisions. If we make that kind of reform, then we have a better idea of how many people, both men and women, are actually neurodivergent. Also, we need to push it. Pushing the examination of young men and young women by psychological professionals means that people will have the opportunity to be assessed apart from their family structures. Men still tend to get prioritized more than women in family structures. Women tend to be forced to mask early on, leading them to carry most of the mental load and the physical load of the family. If we have this attitude of everybody needs to get diagnosed, doesn't matter what your family thinks, doesn't matter what your family can provide for you, which leads to my first point of have it be a publicly funded universal program. By encouraging people to get evaluated, we can more effectively help people before getting into the workplace. Anyway, those are my thoughts. Thank you for watching/listening. Please consider giving this a like, Comment down below if there's something you think I missed, or if you just want to let me know what your thoughts are, and I will see you in the next video.